So, good afternoon, good evening, everybody. My name's Andrew MacMillan. I'm an osteopath. This is my first Facebook Live that I've ever done, and luckily doing it for NASS. So, today's topic, I'm going to be discussing healthy bones and different types of exercise that we can do to keep our bones healthy. Feel free to use the chat box there to ask me any questions as we go. And Zoe Clark, who is also an osteopath who works for NASS, will be there moderating the comments and answering any questions as we go. If someone could just type into the comments box there, letting me know that it's actually all started all right and I'm not just sat talking to myself, that would be very helpful. And then we'll get going. Dun, 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 stone cold silence. So give it a couple of seconds, just let a few people join. Okay, so I can't see the comments because I'm terrible at technology, but Zoe has just informed me that it's working and I'm up, so that's always nice to hear. So she'll keep an eye on those and answer as we go, I'm sure, and I'll keep rudely checking my phone just to see if any major technical glitches have come up. So a bit about me, I'm an osteopath and a university lecturer. So I teach sports and exercise rehabilitation to health professionals. So I teach osteopathic physios how to give out exercises to people for my main job. So osteoporosis is what we're going to be talking about today. Now that's fairly common in axial spondyloarthritis. So things like AS, SpA, they're precursor for it. There's two main types we get. So we get primary and secondary. Primary osteoporosis is the one that most of us are more familiar with, that comes about as a normal part of aging, where we lose a little bit of bone strength and fitness over time. That is more common in rheumatological conditions like AS and SpA through disuse, that people like myself, I'm a NASS member, as well as working with them for things like this, tend to exercise less. Although we know that exercise is very good for the symptoms of SpA and AS, it can be quite difficult to get the motivation and to do things because of pain. So decreased physical activity, decreased loading of bones stops them being as strong as they should be. Bones really like to be used. Our bodies respond well to exercise, movement, things like that. The other type is secondary osteoporosis. So this comes about because of an underlying condition. We know that inflammation, so the swelling that's associated with SpA, with AS, if that's poorly controlled, that tends to lead to weaker bones, more fracture risks. There's also a whole host of the other fun autoimmune conditions like the inflammatory bowel things. So when we get ulcerative colitis, Crohn's, problems with the tummy as a result of these conditions, that can also affect our absorption of nutrients and stuff and can lead to that being more common. So all the boring stuff out of the way, essentially, how can we prevent it? And the way is to exercise. Now, exercise can be very scary and very difficult to do and to engage with, particularly when you're in a lot of pain and discomfort. We know that with SpA, with AS, exercise helps control symptoms. It helps us feel better and get moving. That's kind of like why when we wake up in the morning, we're very stiff, not quite moving as well. Hot shower, start walking about, things ease up a little bit. And that's why a lot of the programs NASS puts on, like the AS stretch and the really useful exercise videos and stretch videos they put out, are very helpful. Now, I absolutely love hydrotherapy. It feels really nice. My local pool's been shut because of the world at present, but that doesn't do anything to build bone strength. To build our strong, healthy bones, we need to, as I mentioned, cause loading, cause pressure through them. And that can be simple things like walking, keeping yourself active and moving around. Weightlifting can be very, very useful. It doesn't have to be heavy. You can do it with cans of drink or tins of beans in shopping bags, stuff like that. Anything that puts pressure through the joints is actually really, really good. That's not going to cause damage, essentially. So it's really good for your bones, good for your health. We tend to worry about leapy, jumpy exercises. Anything that puts too rapid a strain on bones can be potentially dangerous. So the main thing to watch out for with weaker bones is fractures, obviously, and that usually happens with falls or with impact. So for people that are concerned about their bone density, so might be slightly older or like me have had a DEXA scan, so a scan of your bones that says they're not quite as robust as they should be. So we'd avoid things like rugby, running, jumping, trampolining, that sort of thing might not be the best idea to start off with. So you build things up gradually, slowly, with walking, strengthening exercises. But going to the gym, using resistance machines, things like that, really happy to do, very safe. We start gradually and gently increase the load as our bones get stronger. There's a lot you can do with diet. So the main thing to follow is the NHS Eat Well plate model. And that's just lots of green leafy veg, fruits, dairies, things like that we're all aware of. Potentially supplementing with vitamin D, but that's something that you'd have to discuss with your rheumatology team, see if it's right for you for lots of other reasons. Vitamin C, so orange juice, green leafy veg, that sort of thing, lots of calcium. So cheeses, dairies, stuff like that is really, really good, as well as your spinach, stuff like that. Now, for getting into exercise, you can do some really simple things. So a colleague of mine has suggested this, and I really like the idea. It's you get 2 bottles of heavy water. So you get like a 2-litre bottle of water, put them in a backpack and take it with you. And as you walk around, that puts some more load on the spine. It increases the weight you're using. Now, as you start to fatigue or get tired as you're going for a long walk like that, you just take the bottles out and you can pour some of the water away, drink a bit, but it gets lighter and lighter as you go. So you're not stuck carrying really heavy weights out and about with you. The same thing can be used for doing exercise at home. It's free essentially because you just need the container. Do some very gentle exercises as it gets heavy, pour some away and keep going. That can be very useful. The other ones are chair-based exercises. So as I mentioned, the risk of falling is what we want to avoid. So if we can prevent those by getting stronger and fitter, that prevents fractures, which are the worrying thing about osteoporosis. So seated exercises, can sit in my chair, stand my feet, starts to put a little bit of shock, a little bit of force through those joints and encourage them to get stronger. Very safe and very easy to do. The NHS website has a whole section of these exercises that you can see. They're usually termed fall prevention exercises. There's also exercises for older people that are very helpful. So marching on the spot can then be increased to hanging onto a chair, doing little cut phrases, little squats, that sort of thing, up to very gentle little jumps. Now with that, you can see I don't actually leave the floor. I'm coming up onto my tiptoes and back down. We can modify press-ups, so hands against the wall, doing press-ups. That's very helpful, particularly if you've got a posture similar to mine with a bit of an increased curve in the upper back, to strengthen those muscles and help stay a bit more upright. It's a very helpful set of exercises you can do. So kind of like those cobras and bending back exercises, but strengthens through the arms, through the front of the chest. That could be a really nice, easy exercise to do. So let's just have a little look, see if we've got any questions or any comments about specific exercises so far. Is there anything that anyone would particularly like to know? Any advice about things to do or not to do? Exercise is a fairly big topic overall, but essentially starting off with gentle, easy stuff and building it up. The key is not to be afraid to use your body. It can be quite worrying, particularly if you have experienced a fracture in the past. It can be a bit worrying to want to do stuff, but we know that the solution is to move and do things to keep yourself exercising. Great question there coming through. I can see Zoe's texting me, smoking is heavily linked to worse bone density. So there's not an awful lot that smoking is good for. Smoking itself does lead to worse bone health, so the advice would be to stop. With the biologics class of medication that you can take, so the anti-TNFs and things like that, we know they're much less effective for smokers. So stopping smoking is a really good thing to protect your bone health and keep them nice and strong. Interestingly, a lot of the diet stuff hasn't been conclusively shown. So a lot of people say things like avoid caffeine, don't drink coffee, but that's not necessarily true. So Mike has asked for hip exercises. Hip exercises, there's loads and loads. It depends what you're comfortable with and what you can do. Bands or a towel wrapped around your feet, around your knees, can be really helpful. Or you can use your hands, you can pop them on the outsides of your knees, try and create a little bit of resistance. So you hold your knees, try and open them out as you hold. You can do seated marching again, resisting with your hand against your legs, or standing up. So I go a little bit ballet, hold on to my chair so there's no chance I'm falling over, and taking legs out to the side, forwards and back, and again holding on to something, squatting down and standing up. Great exercises, strengthening all the muscles around your bum basically, so squats, things like that. Another really good exercise I like for hips is lying down in bed. You push your foot down as hard as you can against the bed. Now that strengthens your muscles, but because you don't move, it doesn't hurt. I've got arthritic hips. As I move them, they creak a little bit and are quite uncomfortable and painful at times. It can get that sharp pinch into the groin when you try and do things. Whereas the lying down, pushing into the bed, generally doesn't hurt. So you can use pain as your guide, but yeah, keep the muscles around it really, really strong is the best bet. Jogging is okay. Start with a gentle walk and build up. And it depends on your level of bone change. So if you've not been told that you're osteoporotic or that it's a risk, then it will be fine to do. Build up slowly, and more you do is generally good. So if you're worried that you get a thing called a T-score, but that's when you go for your DEXA scan and they test your bone density. If you shouldn't do things like that, you will be told. But generally, jogging is okay. If you're not getting pain and discomfort as you do it, other than the burning lungs and really hard, then it's absolutely fine. So little gentle walks, little gentle jogs are absolutely fine. And so is running. Actually, running is okay. It's just if I've gone from no fitness or no exercise, jumping about and legging it around a park would possibly be a bit much for me. So, been asked, will bodybuilding harm AS? No, not at all. So if you're into bodybuilding, if you've already started it and do it and you're used to safe form and good exercise, it's a really good thing for you. So exercise is key. The main management for AS is exercise. That's far and away been shown to be one of the best things for reducing symptoms, improving quality of life and function. Generally with bodybuilders, great big muscly fellas, they tend to do slightly lighter weights and higher reps. So that's generally out of the weightlifting type things quite safe compared to Olympic weightlifting where you're moving weights quite rapidly, or powerlifting where they're going for maximums. You can mix stuff up a little bit and change some of your exercises. So possibly at first back squats wouldn't be a good idea. So you can try things like front squats where you hold the bar in front of you, or hold dumbbells. So things like goblet squats or suitcase squats if you're into bodybuilding. Deadlifts generally I would avoid, but using machines. So hamstring curls, leg extensions. Bodybuilding, very, very good for AS if you do it with good, clear form, you know what you're doing and you don't go a bit over the top. Because there's a lot of injuries in the gym when people haven't been for a long time or try and do a bit too much too quickly. Drinking red wine, so moderate alcohol intake is okay. It depends how much you drink. I think probably the biggest risk there would be drinking too much and falling over. So moderate alcohol intake isn't particularly a risk with osteoporosis, so should be okay. Yeah, any exercise is beneficial, absolutely. There are benefits from anything. So I often discuss a thing called exercise snacking, which is little and often. It's you've not got time for a full meal, doing some exercise is better than no exercise. So that might be parking the car slightly further away and walking, might be taking the stairs instead of the lift if you can. It can be simple things like you whack the kettle on whilst you're waiting for it to boil. You do some of those squats, some of those wall presses, some stretches and some exercises. Try and build your routine. So little and often for exercise. Some is better than nothing, and try and fit it in as much as you can. Little and often. I actually find with flares as well, managing fatigue and managing energy levels is really, really important. So if I've always gone to the gym and enjoyed it. If I go to the gym too much and go too hard, it will typically push me into a lot more fatigue and I'll feel a bit rough. Whereas if I do a little bit fairly frequently, that tends to be better. So actually working from home over lockdown and doing little bits of exercise at home has been a lot better for me. Any advice on supplements? No. So generally, I would suggest that diet is the best form. So the Eat Well Plate model from the NHS, looking at eating a balanced diet. So I'm very much in favour of food first, as in get most of your nutrients and things from your diet if you can, then look at supplements as an additional extra. The advice on supplements depends on who you are, what other medications and things you may be taking to work around that. So I would say discuss with your with your rheumatology nurse or your rheumatologist or your GP before starting any supplement routine. So that's my little, I've covered myself. Generally, calcium supplements can work if you don't get enough in your diet. I take vitamin D and magnesium because they've been shown to often be quite low in people with SpA and AS. So I generally do take some supplements. Again, because of various issues that are associated with the autoimmune things, I'm on quite a restricted diet. So I take supplements because I can't eat the full range of different foods without getting a few bits of problems. So yeah, if you can get it from your diet first and foremost, that is the most important. And then you can try supplements as long as they're safe for you to do so and won't interact with any other medicine you're on, things like that. Cool. Any other questions? They're coming in. I can see Zoe is typing. Sorry, I can't work out how the chat works there. I've had Facebook for about a week just so that I could do this live. So stiff T-spine, so thoracic spine or upper back and 2 previous fractures. Any exercises? Yes, lots. So Zumba, if that's nice for you, brilliant. One that I quite like is just, you can see that I don't have a terrible amount of movement in my upper back there, but that wall press up can help with upper back flexibility. A little gentle baby cobra, so you don't go very far at all. Leaning too far back isn't a great idea with previous fractures and osteoporosis, but keeping it moving. So it might be rotations and sort of jigs about. If you do Zumba, you've definitely got more rhythm than me for the movement. So it's like you're trying to separate your shoulder blades. Moving. Strengthening exercises there. Again, you can hold onto your tin of beans or anything heavy that you can get hold of. Rowing up and down like that to strengthen through the upper back. You can hold on to 2 tins of beans or weights, lift them up and down like that for the upper back, bending forward slightly. And then another one is to hook a towel over a door frame or similar. Try and row it. So anything that's strengthening those muscles opens up the chest, helps improve that flexibility through the upper back. The other thing that we know works quite well for that, just general flexibility, stretching exercises. The breathing exercises can work really well. So they are on the NASS YouTube page, some of the lying in bed exercises where you open up the chest or just lying flat on your back. So there's loads and loads you can do. Strokes to avoid when swimming. So with that, generally, with AxSpA less so. If you've progressed onto spinal fusions and AS, breaststroke can be really difficult. A lot of people with AS find that swimming with a snorkel is easier because of that lack of ability to tip the head back too far. So my upper back and neck don't move terribly much. So I find swimming can be quite uncomfortable actually because I'm face down in the pool. So using a snorkel when you swim, typically front crawl is easier. Depends how far you can turn your head though to like how much you do. So backstroke can be really, really lovely if you can do it. I can even do that one. Breaststroke can be quite difficult, depends how flexible your neck is to whether you can turn to breathe and stuff like that. But top tip from me is a snorkel when you swim in, can be very useful. Should women change their training after menopause? Not particularly. If you've been training to a level before, you can do the same. It's if you haven't been training for a long time, going into it's harder. But if you're already fit, then that's absolutely fine. We do tend to lose a bit of bone strength with menopause due to the hormonal changes, but that happens with time anyway. So keeping your training load and intensity consistent is most important. So it's big variations in training intensity that tend to cause worsening. Interestingly, actually, hormonal fluctuations in people that are still menstruating, so when you're having monthly periods, just before those hormone changes can change laxity of joints. So actually injuries are more common around periods for people. So that can lead to an increased injury risk and should be taken into account with the at the higher level athletes, so people doing a lot of weightlifting or competition, should be more careful there, less so after menopause. So after menopause, similar sort of training, but watching bone density may change over time. But exercise is the way to prevent that and to keep yourself fit and healthy. Okay, so exercises to strengthen knees, anything for the front of the legs. Leg extension, so when you sit and straighten the legs against resistance, that's similar to the hip exercises. A thing you can do is cross one leg over the other. So the leg that's behind, that's the one that's doing the exercise. So you put one leg over the other leg and then try and straighten it against resistance. And you'll feel that squeezing at the front of your leg. Hold that for 10 seconds, relax, swap legs, go again. That strengthens muscles at your front of your leg. If you can't get in the gym to sit on that chair where you straighten the legs out, the leg extension machine is really, really good for knees. We know that quadriceps, muscle at the front of your legs, getting those stronger is one of the best things for your knees. Body weight squats can help, so standing, again, holding the chair, squatting down. All those sort of things are really, really useful. For tight calves, stretching them, really. So you can stand, put your toes on a step, lean forwards. That's probably the best one for tight calves. If you can reach, give yourself a nice little massage. That can feel quite nice on them. Standing on a step and lowering your heels down. So both feet on the step, just gently lower yourself down. That's nice for plantar fasciitis as well, for the plantar fascia stretch. If you're getting sharp pain at the bottom of your foot, that feels really nice, that stretch. Hurts a bit first few times you do it, but great for stretching the calves. Just typing again, I can see more coming in. No more questions? Fantastic. Oh, wait, I've been told to wait. So back and chest pain during exercise, very, very common. Back pain, this is going to be the most woolly answer ever. It depends what type of pain you're getting. I use a traffic light system with my own training, so it's pain that is tolerable. So 0 to 3, I will push through, and I consider that sort of green. 3 to 6, kind of amber. I'm starting to get a warning this might be a bit much. I'm really stubborn, so we'll probably train into that a little bit. Over about 6 out of 10, stop. The main issue is if you get increased pain the next day. So pain that persists 24 to 48 hours after exercise is more likely to be a bit of an injury and something to watch. Pain at the time, kind of do it. Another rule I use with the gym, particularly if I'm having a flare, is go to the gym or whatever exercise you enjoy and want to do, try for 5 or 6 minutes. If it's not started to go away after 10 minutes, do something else. Stop, try a different thing. Go in with a really loose plan of, I'm going to go for a little jog. If jogging's not working and it's too sore, stop, do a bit of Pilates or stretching or something else instead. Try little and often, move it around and stop. So with most people, I would suggest they're not going to injure themselves with a little bit of pain. With us, we have to be a little bit more careful than that. Chest pain is really, really common with SpA stuff, so costochondritis and things like that can really hurt. So avoid anything that puts direct pressure on the chest. Rib stretching exercises, again, can be really, really nice and helpful. Yes, so AS can definitely cause spasms in the pecs, and a reason for that can be the postural things. So as we're shortening pecs, rounded shoulders and coming forwards, and stretching can help. But we also get a lot of pain on the tendons. So so it's called enthesitis, but where a tendon joins a bone, that gets irritated because of the immune system kind of not liking it and goes for it. So that's what causes the inflammation, and that's what causes the fusion in the spine. So often you will get pain in random muscles and it moves around because the tendon itself is being a bit irritated by inflammation. So yeah, definitely. And often stretching, moving, exercising is really good for that. No direct pressure on the chest. Wall press-ups can be really nice. Pec flies can be quite helpful. And again, that can be arm against the wall and push against it. So you're pushing against your own hand for resistance. Relax. Go again and relax. That can work quite well. But yeah, pec spasms there's not a lot in the kind of science writing about it, but it's something I've experienced myself and it's quite common. Yeah, pec spasms are common. I think it's probably a postural thing that you're a bit hunched over, as well as the tendons being irritated. But I mean, back pain during exercise, back pain is so common in AS and AXPAR. It's like the main symptom that it's really difficult to know what is your sort of normal level of back pain and what's related to the exercise. It's a weird and wonderful thing. The symptoms can be so diverse and move around for different people. No more questions. Well, oh, Zoe's typing again. Lovely. Well, thank you very much for that, everyone. I'm really glad that that was engaging. If anyone thinks of any questions or wants any specific exercise advice, you can drop a message to the NASS team. So thank you for having me for my first ever Facebook Live. Sorry I was a bit clunky with the technology. I've not done one of these before, but happy to do them again. Like as I say, I'm a NASS member. This is something that I live with myself. So a big part of my role and my job at the university I work at is I teach other health professionals about AXPAR and AS so that they give better care to patients. So that when people like me go and see someone, they can ask these questions and they'll get a reasonable answer that's actually based on something. So thank you very much, everyone. I hope you have an enjoyable evening, and any questions in the future, just drop us a message. Thanks very much.